The Attorney TV Show, breaking down current events, no holds barred. The only show with no topic of limits, where all viewpoints are welcome and you live chat during the show. With your host from the West Coast, Attorney and Minister Vicky C. Jackson, from the law office of Vicky C. Jackson in Tacoma, Washington. With your host from the Central Region, Attorney and Minister Urena Ricks Johnson from Ricks and Associates in West Bloomfield, Michigan. And with your host from the East Coast, Attorney, Minister, and Registered Nurse Rossi Williams from Rossi Williams Law Group in Miami, Florida. With our guest in the state of Texas, Miss Joy Grassi, owner Do the Right Thing Healthcare Consulting and Advocacy, over 2 decades in the healthcare field, national advocate and consultant for nurses. Another guest in the state of Texas, Miss Maggie Ortiz, registered nurse, Masters of Science in Nursing. Over 20 years in practice, including critical care, level 1 trauma in the emergency room, an expert witness and national advocate for nurses. In the state of Alabama, Mrs. Crystal Reeves, RN, BSN, CCRN. Over 20 years in healthcare, including critical care, a nurse at a major hospital in Alabama, and board certified in critical care nursing. Save the date and don't miss it. Watch and follow The Attorney's TV show, streaming every Thursday at 7:30 p.m. Eastern Standard Time on YouTube and Facebook. And get a text reminder when the show goes live by texting the word The Attorney's TV show to phone number 33222. And now let's join the attorneys.
Good evening, America. You know what time it is. It is the Attorney's TV show Thursdays. We are breaking down another current event, no holds barred. I am your host for tonight's show, Attorney Rossi Williams of Rossi Williams Law Group in Miami, Florida. And I have with me my esteemed co-host, way out in West Bloomfield, Michigan, Attorney Urena Ricks Johnson from Ricks and Associates. Attorney Urena, can you greet our viewers on tonight?
Hello to our guests and our viewing audience. We have another great show for you. Tune in and hold on.
We also acknowledge our co-host, Attorney Vicky Curry Jackson, out in Tacoma, Washington. She's unable to be here due to the passing of her husband. Attorney Vicky, we miss you, and we cannot wait to see you again. Last but not least, we have with us our very esteemed guest, whom you see here on your screen, and I will be introducing each of them later in the show. Well, let's get down to business. You've seen it, unless you've been living under a rock on another planet, those COVID wars going on in healthcare regarding mandatory COVID vaccinations. Across the nation, we are seeing healthcare workers protesting having to take the COVID-19 vaccination. We are also seeing America in turmoil as people have opposing viewpoints regarding whether or not they should be required to take the COVID-19 vaccine. Now, we're going to watch some footage of a coroner out in Idaho as she talks about the devastating situation where there's no more room, even in the morgue, for people dying from COVID-19. Let's watch this footage.
Homes in your area that have stopped accepting bodies from your office altogether. You had a refrigerated truck that you had to buy to store cadavers. Your staff has been working nonstop. How are you holding up?
Thank you, Boris, for the invitation to come and talk about this. This is really becoming a huge problem in our county and in our state. We are working nonstop. We're exhausted. We're frustrated. I did have to purchase it. It was about last November, December. We purchased a mass fatality trailer just in case we needed it. We've utilized it throughout the last 6-8 months, but now we're packing them in there. Our internal cooler is full. We've now had to hire outside individuals. We're working on contracting with outside individuals to come in and help us transport these COVID, to come in and help us individuals.
Well, there you have it. And that is such a horrifying situation. No room in the inn, if you will. Attorney Urena, I'd like to start with you with a point of substantive law. You live and practice in the state of Michigan. Many hospitals across the nation are requiring healthcare workers to accept the COVID-19 vaccination, even though those healthcare professionals are refusing. Legally, do healthcare employees have the absolute right to refuse the COVID-19 vaccination if their employers require it?
No, they do not have that absolute right. There is a healthcare crisis going on when it comes to this pandemic. It has been research that has been done to say that this COVID-19 vaccine does help to eliminate the spread of COVID-19. And it also helps to, mitigate that when you are a healthcare worker. Healthcare workers are required to have other vaccinations, and this is no different. So the healthcare workers do not have the absolute right to refuse, absent any type of medical or any type of religious excuse or religious exemption. They are required to have the vaccine, and there's no absolute right not to have it.
I agree as an attorney. I'll just add on to that to say that every state does not even allow the religious exemption. So it's very important to know the laws in the state where you are practicing as a healthcare professional or provider. But you do not have that absolute right. Your employers can fire you. And unfortunately, that is what we're seeing happening in many states and hospitals across the nation, especially in the state of New York. Now, what I'd like to do is introduce to you our esteemed panel that we have here with us tonight. And I remind you, viewers, to tune in with us, live stream with us every Thursday night at 7:30 p.m. Eastern Standard Time on the Attorneys TV show, streaming on YouTube and Facebook. Make sure you go ahead and follow us now so you won't miss one episode, and share the show. We also have a new way to make sure you won't miss one show. You can now sign up to get a text reminder when the show goes live. So sign up for that reminder by texting the word The Attorneys TV Show, that's one word, to phone number 33222. All of that information is in the chat box right now, or you can see it on our website, watchtheattorneys.com. So make sure you live chat with us as well. I'd like to introduce to you our esteemed panel. Starting over in the state of Alabama, we have with us Mrs. Crystal Reeves, RN, BSN, CCRN, over 20 years in healthcare, and Mrs. Reeves is a certified critical care nurse. Moving to the state of Texas, we have Miss Maggie Ortiz, RN MSN. Miss Ortiz also has over 20 years in nursing. Her experience includes the ER, level 1 trauma, critical care nursing, and she has served as an expert witness in healthcare. And then right here in Texas, you've seen her here with us before, Miss Joy Grassi, owner of Do the Right Thing Healthcare Consulting and Advocacy, also in healthcare for over 20 years and advocating for nurses across the nation. So we have a very competent, incredible panel with us tonight. What I'd like to do, everyone, is start off by just laying the foundation of where you stand on everything with 3 quick poll questions. So number 1, do adults or should adults have the right to refuse COVID-19 vaccination? We're excluding from that those who have medical contraindications and those who have religious exemptions. I'll go over to the state of Alabama. Mrs. Crystal Reeves, should all adults have the right to refuse the vaccination? Yes, no, or it depends.
Yes.
I'm going to go to the state of Texas. Miss Maggie Ortiz. Yes, no, or it depends.
I agree with Crystal. Yes, you should be able to deny it.
And then Miss Joy Grassi in Texas by way of Boston. So you may hear that accent come out. Miss Grassi, yes, no, or it depends.
Yes.
Oh, wow. Attorney Urena over in Michigan. Should adults have the right to refuse the vaccination?
Yes.
And last but not least, Attorney Rossi right here over in Florida. I say yes as well. So this is one point wherein we all agree. I don't think it will continue that way throughout the show, and we welcome opposing viewpoints here. So that's okay as well. So let's move to question number 2. Now I'd like to focus on healthcare workers only. Should frontline healthcare workers have the right to refuse the COVID-19 vaccine? Again, we're excluding people who have medical contraindications or religious exemption. Miss Maggie Ortiz, I'll start with you. Yes, no, or it depends.
Yes.
Miss Joy Grassi, what do you say about that question?
Yes.
Moving to Alabama, Mrs. Crystal Reeves, what do you say?
No.
Attorney Urena in Michigan, should frontline healthcare workers have the right to refuse the vaccination?
No.
And then Attorney Rossi, I say no as well. So now you're starting to see what happens, everybody, on the Attorneys TV show. Just let the show keep going and you're going to see some difference in opinion, but we're all giving you competent information. And finally, there are many people who believe that the government has responsibility for where we are and not being able to control this virus. And when I say the government, I mean the Trump administration, the Biden administration, the FDA, the CDC. I'd like to know if you agree with that. I'm going to start with you this time, Attorney Urena. Does the government bear any responsibility in us not being able to control this virus at this point?
The government has some responsibility, but not all responsibility.
Okay, and then I will go ahead and weigh in and say yes, unequivocally, yes to me. Not attorney, but Mrs. Crystal Reeves over in Alabama, does the government have any responsibility here? Yes, no, or it depends?
Yes, definitely.
Miss Grassi?
Yes, but not all. I think every human has a part in this, but they definitely play a big part in it in public health agencies.
And then Miss Ortiz.
Yes, I do think that they have. The misinformation has been pretty serious.
Okay. And we're going to dig down. We're going to drill down into these answers. But what we see right now is already a difference of opinion by the healthcare professionals on this panel. Some feel that, I think everyone felt that adults should have the right to refuse. But once we narrowed the adults down to frontline healthcare workers, we saw a difference of opinion begin to emerge. So what I'd like to do is let's talk more about the responsibility of the government. We're going to watch some footage from the Trump administration and the Biden administration regarding COVID-19, what they said. And then I'd like to know whether or not you believe they have the responsibility and give us more information regarding your answer. Let's watch this footage.
Former President Trump, a lot of criticism has gone his way for the way he has messaged on vaccines, of course, declining to get his own shot publicly, all of those things. Last night, he was actually at a rally in Alabama, and this was the crowd's reaction when the president told people, the former president told people to get vaccinated.
I believe totally in your freedoms. I do. You got to do what you have to do. But I recommend take the vaccines. I did it. It's good. Take the vaccines. But no, that's okay. That's all right. You got your freedoms. But I happen to take the vaccine. If it doesn't work, you'll be the first to know. Okay?
Well, if the Trump administration approves a vaccine before or after the election, should Americans take it, and would you take it?
If the public health professionals, if Dr. Fauci, if the doctors tell us that we should take it, I'll be the first in line to take it. Absolutely. But if Donald Trump tells us that we should take it, I'm not taking it.
Hi, I'm Jane O'Donnell, health policy reporter with USA Today. I'm here today with Dr. Anthony Fauci, who's the director of the National Institute for Allergy and Infectious Diseases. Dr. Fauci, coronavirus, of course, has been in the news so much. People are worried. Should they be worried? Are they worried unnecessarily? And what should they be doing?
No, I don't think people should be frightened. I mean, the risk right now, today, currently, is really relatively low for the American public, but that could change because what's going on outside of the United States, particularly obviously in China and in other countries in which there are travel-related cases, that this could evolve, and I think it would be unrealistic to deny that, this could evolve into a global pandemic, which would then have significant implications for us. So although we don't want people to be worried now, I think we need to realize that this could change. So right now, don't worry about it. Be more concerned about influenza, which is going into a second peak for the season, than coronavirus. But keep in mind that the coronavirus situation could change, which is the reason why we're taking it very seriously, because it could be a substantial threat. Right now, we're still in the middle of the flu season. And for flu, you get vaccinated, you wash your hands as frequently as you can, you avoid crowded places where people are sneezing and coughing. That would help protect you against influenza. And if and when, and I hope it's more if rather than when, if we get substantial coronavirus here, those kinds of typical simple public health measures could help protect you against coronavirus. People wearing masks now is just not relevant. You don't need to be walking around with a mask right now. Masks, quite frankly, are more important for people who are infected to prevent them from infecting someone else.
Well, you saw it here. Joy Grassi, over in the state of Texas, earlier you weren't really willing to lay everything at the feet of the government regarding this virus. So explain your answer after seeing this footage. What is the role of the government and where we are now regarding COVID-19?
I mean, the role of the government is to provide us good information, but there are just people that are not going to listen. Certain states, certain people are just going to have their beliefs, and they're not going to go through with like the mask mandates, any vaccines. I mean, I don't think they should be mandated, but the people play a part in this, and it's all about protecting the public. So it seems there's a lot of selfish people out there as well.
Wow. You really took it to the people, that everyone has a role here in being accountable. Miss Ortiz, what do you say in regard to the answer that we've heard here? Miss Grassi says, we're going to put this where it belongs, the fault of the people. Do you believe the government has any responsibility? And if so, elaborate for us more now.
Yes, ma'am, I sure do. From the very beginning, not even want to acknowledge that there was a pandemic, the lack of even wanting to call it airborne, the miscommunication within the CDC, telling us one thing and then changing it up. Yes, they for sure had, and that's continued into the Biden administration as well. I just feel like the lack of communication consistently has just been too much. And it's just really, it's perpetuated a lot of problems. Not all on the people, but for sure government and people.
Thank you. We're really seeing here a very passionate response, I would say, regarding what you feel the government has done and has not done in regarding to the messaging that's been going out to people. Over in Alabama, Mrs. Crystal Reeves, you've been working in critical care. You're certified in critical care. We've seen many, many times different government officials on television saying we don't have enough vents or we need more vents and politicizing this situation. Does the government have any role in this? Because you said earlier there's partly a role. Tell us what you mean by that.
I definitely believe that the government has a role. From the very beginning, they said it wasn't a pandemic. If the proper channels would have been followed, we could have been prepared for this pandemic. We could have had enough equipment to do what we needed to do to save lives. But because people were trying to follow political agendas, we had misinformation, we had miscommunication, nobody was on the same level. They had one job, and that was to serve the public, to save the public, and they failed.
Wow, I haven't heard that in a while. You had one job. Everybody knows what that means. You didn't have but one job, government, and you failed to do it, and people are paying the price for that. Attorney Urena, I'm hearing people say that this is a hoax. COVID is a hoax, and I'm sure I'm not the only one who's heard it. I'm sure all of you on this panel have heard it. And what's more is that the people who are saying it, they believe this to be so, which affects their decision making regarding what they should do. Is COVID-19 a hoax?
Not at all. I do believe that it is here and it has been here, and this specific strand of the coronavirus is here and has been deadly. I've known people that have passed away due to the COVID-19 virus, and I do know that it's here and it's not a hoax. I think that what happens is that it has affected some populations in some areas differently because due to maybe underlying conditions, due to whatever the disparity is with healthcare. And I think that because it has not necessarily knocked on some people's door or has not been close to them, they feel that it is a hoax. But it is not. It is here and it has affected people negatively. We still have people that have died from COVID. We have people that it has had long-term effects on, even after they recovered. So it is here. It has caused definitely a great hardship on the United States and abroad, and it should not be downplayed at all.
And I really, I have to agree with you, especially that last comment, being an attorney and a nurse. It should not be downplayed at all. I'm sure almost everyone or all of us on this panel know people who have been diagnosed with COVID and probably people who have died with COVID. And I do agree with what I heard Ms. Ortiz say, and really everyone talking about the inconsistent messaging that we received in the beginning. And I will tell you that I found no credibility eventually in Dr. Fauci. And those are my words, not the words of anyone else on this panel, but everyone knows that I stand behind what I say. I believed initially he was very, very credible, and he had the hearts, eyes, and ears of people listening to him. But the inconsistent messaging over time really just began to come in and implode the credibility to the point where the government has no control. And I really believe there needs to be a new face of the messaging. I don't think he's that person anymore. So I know some of you may not like what I'm saying. Just type your comments in the chat. You can live chat with us right now. So you're on Facebook or YouTube, type your comments in. We welcome all viewpoints here. I'd now like to deal with vaccine passports. We've really seen this in the media in the state of New York, because in New York, the people are not able to enter restaurants. They're not able to go into the gym or other indoor establishments or activities without showing proof of vaccination. And that proof has now become known as vaccine passports. Ms. Ortiz, RN MSN over in the state of Texas, I'd like to know, should people have to provide proof of vaccination to enter these establishments? Does the proof of vaccination somehow give them more protection because they're vaccinated going into these indoor events or activities?
No, I don't think that you should have to show your vaccination status. And I feel like it sets up a false sense of security that if you're vaccinated, that you somehow cannot magically, spread this virus, which is absolutely not true. So creating this tool that we're calling, the passport, is creating disparity. And I don't feel like that should be mandatory. Absolutely not.
Well, let me follow up with you on that. Now, are you saying that people who are fully vaccinated could also contract COVID-19?
Yes, ma'am. Absolutely, yes. Just like with any virus, that's what a virus is that it will always be changing. You can always contract a virus. It's not like a bacteria. It's different, yes. Even with other viruses, with flu, H1N1, we saw people who were vaccinated for years contract H1N1 and die. So yes, you can, absolutely.
And I agree with you about that false sense of security, because we have seen times that there were breakthrough infections, and you have people who are feeling like, well, as long as I'm vaccinated, I can be in a crowd anywhere and I'll be okay. I mean, we're seeing crowds at football games packed in like sardines. And so when I see then that to go into a restaurant, someone needs to present a vaccination card, I'm really trying to find out why the hypocrisy. How can I go to the football game and have 50 or 100,000 people or however many people packed in like sardines, and there's no worry? Or I could be at the Emmys and everyone's there and they don't have on masks or social distancing and there's no worry, but there must be worry when I go into the restaurant to eat. So, Mrs. Reeves, you also are a critical care nurse. You're certified in critical care. When we're looking at all of these people who are dying from COVID, we're looking at all of these numbers increasing every day with people who have contracted the virus, but we have frontline healthcare workers saying, no, I don't want it. How do you respond? Should frontline healthcare workers have to be vaccinated? You gave us your poll question answer. Explain your answer to us.
I think that they should have to be vaccinated. I think that because they're frontline workers, they're at a higher risk of contracting COVID. With the virus that's out now, it's even more deadly than the first one that was out. And I just think that in order to protect their lives, that the vaccine will help with that. It will decrease deaths. It will decrease hospitalizations. And hopefully we can get a handle on this deadly virus.
But these healthcare workers are saying this is their right. These are their bodies. Mm-hmm. And they're social distancing. They're even saying they've been forced to work multiple shifts before we even had approved vaccinations. So knowing that some healthcare workers just are not going to take the vaccination, and if they don't show up for work, it could cause a shortage in staff. Do you still believe that the frontline healthcare workers should take the vaccination, be required to do so?
I do, and this is a very controversial subject, but in the end, I think it's better to protect yourself than to play a crapshoot on it. I know the research is early. I know the research is new, but the numbers prove that the vaccine is decreasing the number of COVID cases.
Well, I tell you what, I don't need to be any kind of anger translator or passion translator on that. We heard it. Mrs. Reeves said it may feel like a crapshoot, but it is what it is. You have to protect yourself. And to everyone tuning in with us right now, we welcome you. This is the Attorneys TV show, live streaming every Thursday at 7:30 p.m. Eastern Standard Time on YouTube and Facebook. So make sure you follow us on YouTube and Facebook, and that you sign up for a text reminder every Thursday when the show goes live by texting the word The Attorneys TV Show, that's one word, to phone number 33222. You should see that in your chat box right now, or you can also see that on our website, watchtheattorneys.com. And remember to share this show and live chat. All viewpoints are welcome. So you answer these questions as well by typing your comments in on Facebook and YouTube. And for those of you who are just tuning in and you see our very esteemed panel here, if you are unable to see on your phone, remember that if you have YouTube TV on your television, you can go to YouTube on your television, type in the Attorney's TV show, and watch this show on television as well. We have with us tonight Miss Crystal Reeves, who is a registered nurse in Alabama, Miss Maggie Ortiz, who's a registered nurse in Texas, and Miss Joy Grassi, who's the owner of Do the Right Thing Healthcare Consulting and Advocacy in Texas, and of course, my esteemed co-host, Attorney Urena Ricks Johnson in Michigan, and I'm your host for tonight, Attorney Rossi Williams. You know, I'd now like for us to just discuss the impact of social media on COVID-19. We have everyone, their mother, their grandmother, cousins, aunts, uncles, once removed, giving their opinions on social media. And it seems like to me they should be able to do so. But what has happened now is we saw recently a situation where Nicki Minaj, who is a rapper with over 2 million followers, was suspended from Twitter based on a tweet she drafted regarding the side effects of the vaccination. And she stated that her male cousin had a very undesirable side effect. And you can see that tweet now on your screen as we're talking. So reporters asked President Biden about the impact of social media on COVID-19 regarding misinformation. And his response was that the misinformation on Facebook and social media is, quote, killing people, unquote. Let's watch right now.
What's your message to platforms like Facebook? They're killing people. I mean, it really, look, the only pandemic we have is among the unvaccinated. And they're killing people.
Well, there you have it. He's the president of the United States. So if he said it's killing people, it's killing people. But what I'd like to know from each of you tonight is whether or not people should be able to voice their opinions on social media. Is what they're voicing really having such a negative impact? Miss Ortiz over in Texas, what do you say about that?
I think you should be able to voice your opinion. Consider the source. Come on, she's a rapper.
Well, okay then.
I mean, let's be real. Consider your source.
And I have to say that was very concise, but it is a point well taken. Consider the source. Now, if you're taking your advice, your medical advice, viewers, from Joe Smo Blow and Johnny Sue McCain, and they don't even have any credentials or even a blue verified check mark. If you're taking your medical advice from them online, I mean, don't you bear some responsibility in that? Should these social media companies really become the guardians of the information? What do you say about that, Ms. Joy Grassi? Should
Well, I think we're going to
their opinions?
Of course. And I think that she's really speaking to a situation she had or an experience with a family member. And as I say, we don't know, I prefer to listen to science, but Nicki Minaj may have the cure. We don't know. Because she sounds as simple as anybody else at this point. I mean,
if she does come out with the cure or anything even close enough, even a temporary relief,
right?
Make sure you hashtag the Attorney's TV show.
Yes,
we got
and
you.
let Ms. Minaj know that you heard it here first.
I'm sure it's gonna be on. It's gonna be everywhere tonight, anyway.
Okay. Yes. Because we do have this, this esteemed panel here, and we love giving you this substantive information and also just being real, right? It's a serious topic, but laughter is a good thing. And so we want you to always leave the show well informed, but also feeling encouraged. Miss Crystal Reeves over in Alabama, is social media having a negative effect on the vaccination or how people are responding due to misinformation?
I think it does have some negative effect. And as a medical professional and as a human being, you should pay attention to what you're actually reading and believing in. Use credible sources such as the CDC, or go to your local health department. Call your doctor. There's other ways to get information, not just off of Instagram or Nicki Minaj.
Well, everyone, you heard it here. Read, but pay attention to who's giving you the information. I would like to deal with one other thing right quickly. In New York, what we saw is the governor saying that if the healthcare workers were not vaccinated by a certain time, and that date has passed, that the healthcare workers would be fired. And that has happened to a lot of healthcare workers, and they have protested. We're seeing other states follow suit. And for me, I always wonder about the avalanche we're going to have of shortages in staffing. If nurses can't come to work because they're not vaccinated and they refuse to get vaccinated, at some point, I think the patient will suffer. So I go to you, I'll start with you again this time, Mrs. Reeves, as a critical care nurse. If you see understaffing, consistent understaffing in ICU, what types of effects in general might that have on patient care?
On patient care, it's going to be detrimental. You're not going to have the necessary numbers to take care of your patients. But let's not even talk about patients right now. Let's talk about the nurses, those patients.
Miss Grassi, you're the owner of Do the Right Thing Healthcare Consulting and Advocacy, and you've advocated for nurses all over the nation in regard to issues such as staffing or understaffing. Let's go back to what Mrs. Crystal Reeves said about the effects of understaffing on nurses in healthcare. Do you also believe that nurses will just stop showing up if they continue to be understaffed?
I mean, experienced nurses and travelers that have been doing this for a long time, yeah, they don't want to do it anymore. But there's agencies, there's government funded agencies, and they pay a lot of money. Hospitals pay $0 for them. So I almost think that they'd rather have, like, there is understaffed, and then there's government money, and then they bring in young nurses they glamorize the travel, right? So I'm sure Crystal's seen that we have young nurses coming in to fill the spots of the experienced ones that are kind of tired of what's going on in this healthcare industry, which I call business care now, okay? I've worked 15 years at the bedside, and I've never seen such a change, and I've never seen it so big here.
And this is really something, let me say, this is really something that people need to pay attention to. Mm-hmm. Viewers, government officials, hospital administrators, all of these people who are grandstanding, telling these healthcare professionals and nurses, well, you're going to be fired and we'll bring in nurses from other states to replace you, or we'll do A, B, C, and D. What happens when you have no one to replace them?
Oh, they will. They pay them $10,000 a week. And the hospital pays $0 for them. So you won't run out. You'll just get inexperienced ones, which is just as bad.
Just as bad.
Just as bad.
I got you, girl.
I'd have to say even worse, right?
Even
wow.
worse.
You got a body at the bedside who doesn't know what he or she is doing. And I said this once and I'll say it again, and then we're going to move on. The competency and skill level of ICU nurses, trauma nurses, ER nurses, that is usually going to be above the general skills and competency and knowledge level of nurses who are not operating in those areas. That's why when you go on the med-surg floor, you can see that the nurse has more patients. When you go into ICU, Crystal Reeves has worked in surgical intensive care, medical intensive care. Joy Grassi here has worked in critical care. Miss Maggie Ortiz has worked in critical care. If you've ever had loved ones in ICU, you see that the nurses don't have but one or two patients because of the acuity of the patients and the training that those nurses have to work with those vents and all of those tubes and everything that you see. That's not general nursing knowledge. And I can say that because I'm a registered nurse as well. So you can't just bring in Nurse Rhonda.
Yes, you can.
From across
sure
the street to
sure you can. So she's cheap enough. Yeah, you can.
Hey, this is the attorney.
That's tax. They're bringing in nurses right out of nursing school to travel and fill these spots. So I'm not going to be quiet about that. It's dangerous. It's unsafe. And they push out experienced ones. And I appreciate people like Crystal that are there that are kind of hearing this and listening because she sees it. But don't think because I worked in CVICU, you don't think I ever got 3 patients? And this was like Ebola, you know? I mean, wasn't even considered a true pandemic. Okay, they pile it on because that's.
I agree, and I can tell you right now, here in Austin, Texas, there are 2 hospitals who cannot support a STEMI team. That is a heart attack team because you know why? They don't have enough nurses. They're on diversion. They have 1 nurse. One hospital has 1 nurse, and they should have 10. That means that they can't support you having a heart attack in your community. So it is a problem. That's a fact here in Austin, Texas.
All of Texas, it's bad.
Well, let me say this, viewers. Let me
Hashtag Texas.
Let me say this, viewers. This is why you don't want to miss the Attorneys TV show. Because we bring you the information from very qualified guests as we have here on tonight's esteemed panel. But we also encourage and allow our guests to just deal with the facts of whatever the topic may be, the way that they see fit from their professional opinions. And what you're really witnessing here tonight is the heartfelt passion of our panel and the righteous anger in some of these scenarios of our panel. And again, as we move forward, I just want you to think about what we're saying in regard to the competency of the nurses who work on those types of floors. These municipalities can bring in new grads, but there is no way a new grad can walk onto an ICU floor and be competent.
They're not allowed to. And they're legally not allowed to. For every border nursing, it says you're not allowed to take an assignment. It's not in your skill set, your scope.
Exactly.
It's a violation of their border nursing, period, the end.
Ever hear of auto offers in travel nursing?
All right, everyone. Thank you, panel.
Crystal,
we're glad to have these panelists back because we are fired up tonight on the Attorneys TV show. But I will tell you that I love it. I love it because standing up for the nurses also is standing up for the patients.
Exactly.
It is standing up for the families. Because I'll say this, and we're going to wrap this up. My dad passed away last year. Oh. And I'm sure so many of you have had loved ones pass away. And due to COVID, these people are dying alone already because you can't have your family at the bedside with you. So the last thing you want at the bedside is an unqualified, incompetent person caring for your loved one. Because if they pass away, God forbid, let it be from the disease process, not from the negligence of the hospital. And I'm going to stop there because my attorney hat is really, really getting upset about this. And Attorney Urina's attorney hat is really getting upset about just bringing in anybody to care for people's loved ones. But that's up to you, America, to step in and stop. You vote these people into office. So don't just let them threaten to fire the healthcare professionals without assuring you of how they will replace these nurses with similarly qualified nurses. who have the same
It's
training,
administration though too. That's the problem.
Right?
It's not crystals, it's administration.
Exactly.
We
But
are
we
the
have
problem.
to end. But we're going to have everybody
Not
back
President
tonight.
Trump and Biden or whatever. Like they have nothing to do with it.
Listen, this is the Attorneys TV show. We are here every Thursday. We live stream and we break down current events, no holds barred. We bring in guests from across the nation, such as you see here, this esteemed panel tonight. And what I'd like to do, panel, is to give you one last opportunity to speak to America. I'm just going to give you 30 seconds each. And I want you to tell America whatever it is that you need them to know about these vaccinations. Mrs. Crystal Reeves, certified critical care nurse in the state of Alabama. What do you say to America?
I would like to say to my colleagues, thank you for your tireless efforts in saving lives and trying to stomp out this deadly virus. And to the general public, do your part. Mask up, social distance, wash your hands, vaccinate, and don't think of this as just the other person's problem. This is everyone's problem.
Excellent. You heard it from Alabama. Mask up and do your part. In the state of Texas, Miss Maggie Ortiz, RN, MSN, 20 years in critical care, ER, and level 1 trauma nursing. As expert witness, what do you say to America? 30 seconds. What's your message?
Can't mandate the vaccines. We don't have enough nurses. They will leave. If you want someone to take care of you, you can't mandate them.
You heard it. You got to take care of the nurses. You must take care of the nurses. They are the frontline healthcare workers. Also in Texas, 30 seconds, Miss Joy Grassi, owner of Do the Right Thing Healthcare Consulting and Advocacy. What is your message to America?
Just stop thinking about just yourselves. Think about the other people that are around you. And I'm talking about nurses, doctors, too, janitors that work in hospitals, anybody on the outside, just do the right thing.
No pun intended. Do the right thing. Owner of Do the Right Thing Healthcare Consulting and Advocacy. Attorney Urena, my co-host over in the great state of Michigan. What is the message you give?
Educate yourself. Make sure that you have the right information to make an educated decision about the vaccine and do it.
Education is the key. Knowledge is power. And I will wrap it up by saying to America, learn again to respectfully disagree. Whether you get vaccinated or not, follow all of the other protocols and stop polarizing and politicizing COVID-19 because people are dying everywhere and we need to get it together. We can do better than this. Now, Miss Joy Grassi, can you tell our viewers how to reach you as the owner of Do the Right Thing Healthcare Consulting and Advocacy?
The quickest way is always my cell phone, which is my work phone, and it's 978-835-6203. You can text, call, just say who you are. I'll get right back to you. I also have a website, DTRT Healthcare Advocacy and Consulting. We're still building it, but it is there and available. But quickest way is my cell phone, and all are welcome.
And that information is in the chat, everyone as well. Miss Joy Grassi, we thank you for being here tonight.
Thank you for all you do, Crystal, Urenia, and my girl Maggie. Thank you.
Thank you. Miss Maggie Ortiz, who also is an advocate for nurses, how can our viewers reach your business?
I'm actually an advocate for patients and for nurses. So if patients are having problems as well, they can reach out to me. And it's just advocates4@gmail.com. Advocatesfornurses@gmail.com.
And everyone, that information is in the chat as well. Miss Crystal Reeves, we thank you so much for being here tonight. Miss Maggie Ortiz, we thank you so much for being here tonight. Miss Joy Grassi, we thank you so much for being here tonight.
Thank you.
Attorney Urena of Ricks and Associates out in West Bloomfield, Michigan, my esteemed co-host. Can you tell our viewers how they can reach Ricks and Associates?
You can reach us on our website at www.ricks-law.com or at 248-466-0303.
And I am Attorney Rossi Williams of Rossi Williams Law Group in Miami, Florida. You can reach me on my website, callrossiwilliams.com, and social media, Rossi Williams. Rossi is spelled R-A-W-S-I. Now, the last thing we want to do is what we do for every show. Because Attorney Urena and I are both licensed ministers, we end every show with an inspirational prayer. And so we would just ask that you bow your heads. Lord, tonight we've talked about a very controversial issue. We've dealt with vaccinations and the variance in differing opinions. We have viewers watching, some who agree with vaccination and some who do not. We have leaders over the world, some who agree and some who do not. We have children in schools, some whose parents agree they should be vaccinated or wear masks, and some who do not. And we've allowed this to become a very polarizing issue between and among us. We ask God that most importantly, you would heal those who are sick, going to the hospitals, the hospice organizations, the hospice homes, go into their homes, wherever they are, and heal their bodies. We ask then that you would encourage their families as they go throughout this time. And finally, that you would encourage, bless, cover, and answer the prayers of every viewer, every guest, every person to make us all a better nation. In your name we pray. Amen.
Amen.
This has been another powerful broadcast of the Attorneys TV show. Follow us on YouTube and Facebook and sign up to get a text reminder every Thursday when the show goes live by texting the word The Attorneys TV show to phone number 33222. Share this show. It will be available on YouTube and Facebook even when the show is over. Share it with other people. And we'll see you next week. Good night, America.
Good night.
Good night. Bye. Be well.
Yes! You just watched another exciting broadcast of the Attorneys TV show, breaking down current events no holds barred with guests from across the nation. Streaming every Thursday at 7:30 p.m. Eastern Standard Time on YouTube and Facebook. Follow the Attorneys TV show channel now so you won't miss one show. And sign up to get a text reminder when the show goes live by texting the word The Attorneys TV show to phone number 33222. With your host from the West Coast, Attorney and Minister Vicky C. Jackson from the law office of Vicky C. Jackson in Tacoma, Washington. With your host from the Central Region, Attorney and Minister Urena Ricks Johnson from Ricks and Associates in West Bloomfield, Michigan. And with your host from the East Coast, Attorney, Minister, and Registered Nurse Rossi Williams from Rossi Williams Law Group in Miami, Florida. With our guest in the state of Texas, Miss Joy Grassi, owner Do the Right Thing Healthcare Consulting and Advocacy, over 2 decades in the healthcare field, national advocate and consultant for nurses. Another guest in the state of Texas, Miss Maggie Ortiz, registered nurse, Masters of Science in Nursing. Over 20 years in practice, including critical care, level 1 trauma in the emergency room, an expert witness and national advocate for nurses. In the state of Alabama, Mrs. Crystal Reeves, RN, BSN, CCRN. Over 20 years in healthcare, including critical care, a nurse at a major hospital in Alabama, and board certified in critical care nursing. So save the date, watch, and don't miss the Attorneys TV show, streaming every Thursday at 7:30 p.m. Eastern Standard Time on the Attorneys TV show channel on YouTube and Facebook. And sign up to get a text reminder when the show goes live by texting the word The Attorneys TV Show to phone number 33222. See you next Thursday. Don't miss it. Spread